Okay, we are moving on to ECGs, and what we are going to talk about is how that kind of, why is it that we even talk about ECGs? Well, the reason being is because the ECG wires actually are artifacts, and we do a lot of chest X-rays, and the last thing we need is to have artifacts from the wires of the ECG. Okay, so what happens is that you can get 3 lead, 12 leads, all of these different types of leads that can occur depending on if it's a cardiac patient or not. When we're looking at the leads themselves, we're just going to start with a 3 lead. And the 3 lead is going to have 3 colors. I'm not sure if you can actually make out those colors. One of them is green, the middle one's green, one of them is black, and one of them is white. Okay, so that being said, the wires themselves will have an attachment, and each of the attachments will come in a couple of different designs. Here's again to just another example of 3 different color leads. We have a black, a white, and a green. Okay, so what happens is that sometimes we have patients come over to the X-ray department because they want 2 projections of the chest, not just an AP in the stretcher, but 2 projections of the chest. Most hospitals will have a designated area in the emerge department that is for cardiac patients. Okay, and that area is going to be very close to the nurse's station, right? And that's so that the nurses can keep a very close eye on those cardiac patients. When it comes to these ECGs, sometimes what happens is that these ECG wires, sometimes what happens is the patient comes over to the department and they aren't even hooked up to the ECG monitor itself. They just come over with these attachments. Okay, if they just come over with these wires dangling and it's not attached to a monitor, you're more than welcome to take these wires off. Okay, the thing is though is that we take them off, we have to put them back on. So I'm going to tell you where they go. If the patient does come over to the X-ray department and they are hooked up to a monitor, please do not remove the wires. Okay, they must stay as is, and we are going to place the wires off to the side and on the shoulders when it comes to taking the chest X-ray. Okay, it's a little bit of finicky work, but it is important to have a chest X-ray without artifacts on it. The adhesives, when it comes to clicking the different ECG wires on there, the adhesives come in a couple different sizes and shapes. Yes, you will have a bit of an artifact from the button, depending on the make of it or what have you, but we don't remove the adhesives. We leave those in place. Okay, either we remove the wires if they're not hooked up, or we bring the wires up to the side. There are different types of attachments. Okay, and so one attachment here, it's a spring-loaded one. Let's see if you guys can. It's a spring-loaded attachment. Okay, and so it's just a pull here, and then that would clip on the little monitor itself. Okay, the other one is a snap or a button one. So for instance, in this case, like this one, this would be a snap. So there's a couple of different designs. What's really kind of important is that if the patient does come over to the department and they're on the monitor, or perhaps the patient is not stable enough to come over, okay, they're not comfortable with the patient coming over to the department, and we go over and we take a portable AP chest X-ray with the patient in emerge. What happens is that these adhesives at times can come loose. Okay, if the patient is diaphoretic, if they're sweating profusely, then the adhesive, the glue itself becomes loose. And so, or sometimes when the patient moves, or we position the CR cassette or the DR reader, the DR cassette itself behind the patient, we can unfortunately snap these off. So if you do accidentally snap them off or dislodge them in any way, just put them back, okay, the way they were. And we always leave the patient how we found the patient. So if we were over to in the emerge department and we decided, okay, we're going to just leave the patient as is, but we have to move the wires, what we're going to do is we're going to take a lot of time and effort to bring those up and onto the shoulders per se. Okay, there are the 3 colors that we just briefly mentioned. We have the black, white, and yellow. And if a wire was to come off, or I should say, if you took a wire off and you're kind of going, okay, now how do I put these back on? Here's the trick, okay? White goes to the right side of the patient. Black goes to the left side of the patient, up here, and then the green goes down by the abdomen. So white, right, black, left, green is down by the abdomen. So it'll be the white and particularly the white and the black wires that you're getting up onto the shoulders so they're not over top of the chest. The green one, which is on the side, it's okay with it. It's okay if you do that. Okay, you just kind of bring it down over there per se. So if you do have to disconnect a patient or the wires come loose or what have you, it's those colors that are standard as far as where they're to be applied. It is important, like I mentioned, to get those wires off per se. And if you're ever in Emerge and you're working with a cardiac patient and something that like the monitor starts, the alarm on the monitor starts beeping or what have you, just stop what you're doing. Okay, get out of there. Pull your mobile, pack it up, pull out of there, get some help, make sure that that patient is stable before you continue on with that chest x-ray. The last thing you need to do is have that patient have a cardiac experience while the mobile's in there. It's hard to get at that patient, et cetera, like this and that. So we don't expect you to have an understanding of the ECG or anything like that per se, right? On the monitor, you'll see that little strip going on or what have you. But you'll know, like that monitor will start screaming if it's not happy, okay, if something's not going well for the patient. So again, too, if the patient comes over, they have these wires, but they're not hooked up to the monitor, you're welcome to take the wires off for the chest x-ray, but please put them back on prior to having the patient brought back over to Emerge. Okay, that's the main thing from an x-ray perspective. Okay, thanks.